Some studies have shown that 1 kg reduction in weight can lead to as much as 3.4 millimeters of mercury reduction in systolic blood pressure and 1.3 millimeters of mercury reduction in diastolic blood pressure. You know, the systolic is the one up, diastolic the one down. And another study has shown that 5 millimeters of mercury reduction in blood pressure, the systolic now, can lead to 34% reduction in the risk of stroke and 21% reduction in the risk of heart attack. What does that tell you? That means if less than 2 kg reduction in weight can lead to this wonderful improvements in your risk of having these complications. Just a little. How much more if you lose 10 kg? So what is this telling us? Weight reduction is a powerful way to start. We're going to deal with all of this. Another thing to look at now, if you go to see a medical practitioner in quote, and the person measures your BP and say, oh, it's very high, and then starts prescribing drug, that is the cardinal sign that that person is a quack, doesn't know what he's doing. Just run away. Run away. Because there are a lot of things to consider, as we shall see, when trying to prescribe drug or general management of someone with hypertension. By the way, I'm Dr. Sai, a medical doctor and the principal tutor of Dr. Sai Physiology Academy, DOPA for short. Welcome to DOPA Tonic, where we democratize medical knowledge, making it easy even for a 10-year-old to understand, so you can take better charge of your body and health. Now let's get started. So the first thing that we're going to be considering now to help us understand this mystery, what are the things that determine your blood pressure, the blood pressure of a human being? What are the things that determine it? 2 major things. Listen very carefully now. 2 major things. One of them is how much volume of blood the heart is pumping out. Okay, so it depends on the force of the contraction. The heart is a muscle. Hope you know that. The heart is a muscle, so it contracts and pushes out, pumps out blood. It's a muscle. Then another thing is pumping out that blood into blood vessels. They're like tiny pipes. Okay, so another thing that determines blood pressure is the diameter of those blood vessels. So when blood is flowing in a diameter that is like this and a diameter that is like this, which one do you think the pressure will be more? The one that has smaller diameter. The smaller the diameter, the higher the blood pressure. Are you getting it now? These are the 2 major things. And when we talk about the diameter of the blood pressure, they usually refer to it as peripheral resistance. There are 2 things that determine that. There are chemicals that help, because what controls the diameter, they are also muscles. They call them smooth muscles. When they contract, they will reduce the diameter. So some chemicals affect those smooth muscles, okay? Some nerves and all of that, which release chemicals, they affect it. All right, one of them is angiotensin 2, and so on and so forth. Another thing too, if your cholesterol level is high, it can start coating the blood vessels. As it's coating it, is reducing the diameter. They call it atherosclerosis. So if it starts reducing the diameter, it can increase blood pressure. Do you understand these 2 things now? The diameter, then the force of contraction. Then the force of contraction is now determined by also nerves that are supplying the muscles of the heart. Okay, the nerves, then also the muscle itself. Okay, and then the blood volume. The more blood volume that you have, the more blood that will go to the heart, and the more blood that goes to the heart, the stronger the heart will contract in order to be able to pump all of them out. What I've mentioned now, 4 factors. Now, the nerves supplying the heart, okay, the muscle of the heart itself, then blood volume, and then for the vessels, the diameter of the blood vessels controlled by chemicals. So these are the 4 major factors that determine. And also there are 4 major classes of anti-hypertensive drugs. Okay, we call them A, B, C, D. We're going to get into that. But first of all is the lifestyle modifications that helps to reduce your weight. That's the first most important thing, because for some people, that's all you need to take your blood pressure down. Remember I said that 10 kg reduction in body weight can lead to up to 30 millimeters of mercury reduction in blood pressure. That means if your blood pressure is like 150 something, it can reduce to 120 something, which is already normal. Do you understand that now? So what are the things? They call them dietary approach to stopping hypertension, DASH. All right, so the dietary approach, the things that you need to take: nuts, walnuts, cashew nuts, coconuts. They are very good. People with hypertension, okay, nuts, and so many other things. The dietitians and the nutritionists, they will give you more details, but these are very good things that you should take. Dietary approach, okay. Another thing: salt restriction. Reduce salt intake in your foods. Why? Salt contains a lot of sodium chloride, okay, and when sodium is high in the blood, it likes to drag water, it likes to retain water with it, okay, so that the concentration of the blood, I'm using lay terms now, so that the concentration of the blood will not be too high, so it will tend to retain more water. So the higher the salt you take, the more water your body will retain, so that it doesn't increase the concentration of the blood, and which will now lead to high blood volume. And you remember what I said about high blood volume? When your blood volume is higher, the heart will want to beat more forcefully to pump everything out, which will increase blood pressure. That's why they tell you reduce salt. You need to understand these things so you can discuss intelligently with your physician. Do you understand that now? Salt reduction. So when you reduce sodium, you increase potassium. So take foods that are rich in potassium. A very good example is banana. So banana is a very good fruit for people with hypertension, okay, and apples and all of that. So the details are going to be given to you by a nutritionist, a physician, but it's just very common ones in our environment. Banana, apples, very good for hypertension. Then generally other fruits generally, and vegetables, a lot of vegetables. So this is the dietary aspect, okay. So when you do all of that, reduce your food intake and so on, your body weight will come down when you mix it with exercise, or not only just that, okay, with exercise, so that you don't gain so much weight. Mix it with exercise, and then these dietary modifications that I've just mentioned, start taking healthier foods, your weight will reduce and your blood pressure will reduce. Do you understand that now? So that's the first approach to effectively manage. So even if the reduction in weight does not fully control it, at least because your blood pressure has come down, when you want to now start taking drugs, you will not need to take higher doses of drugs. Of course, you know drugs are chemicals with their side effects here and there to your body, okay? So to reduce the dose of drugs that you are supposed to take, which is good for you. So the dietary aspect, exercise, food and all of that, and then you now enter the drugs. So now let us talk about the drugs A, B, C, D. Let's understand that. If you've enjoyed this content so far, kindly click the like button and also the subscribe button, and don't forget to turn on notifications so you don't miss any new content that will drop. We'll be dropping content like this every weekend to share to your friends and all those you think will need this content. So the A, B, C, D types of drugs used in teaching. The A, it stands for what we call it ACE inhibitors. ACE inhibitors. Angiotensin. You said angiotensin is a chemical in the blood that helps to reduce the diameter of blood vessels, which increases blood pressure. So that's why it's inhibiting it. ACE inhibitor. So it reduces the levels of angiotensin too, so that the diameter of the blood can be wider, which reduces. That's what it does. Another type is also called angiotensin receptor blocker. They do the same thing. They just reduce angiotensin, that chemical. That's A, Okay, ACE inhibitors, then ARB, angiotensin receptor. So that's another type. So what is the importance of this type, the A type of antihypertensives? Now they are very good for those that have diabetes. Okay, you already have diabetes and now you're discovering that you have hypertension. They are very good because it helps to protect the kidneys. Also, those who have had heart attack, previous heart attack, this particular type of drugs are good for them. That means they are protective of the heart. They are renoprotective. That's the kidney, renal. Okay, the kidneys, renoprotective. So these are things you're going to find out. So that's why I said anybody that just start prescribing drug, the person doesn't know what anything is doing. You need to ask a lot of questions, do a lot of tests to see the functionality of the heart, of the kidneys, and so on, to determine the best type of drug that you're going to give to the person. Okay, ACE inhibitors, they end with pril, captopril, lisinopril, and so on, while the ARBs, they end with satan, valsartan, losartan. Okay, so the expert you need to see is a physician. They'll give you more details. So the next one is the B class. The B class, they call it beta blockers. So this beta blocker, what they do is they block the effect of adrenaline. They also call it epinephrine. What it does is that it helps to increase the force of contraction of the heart. Adrenaline, that's one of the actions. Okay, and even the blood vessels too, it helps to reduce. It's one of those chemicals that help to constrict, reduce the diameter of blood vessels. So this beta blocker, they oppose it, they block it. See it? They block the effect of adrenaline so that they reduce the force which the heart contracts and also increase the diameter of blood vessels. So that's how it helps. And this particular type of drug, they usually end in LOL, L-O-L, propanolol, atenolol, and so on. But there are certain types in these beta blockers that are especially good for those with congestive heart failure and heart problems. Okay, an example is metoprolol. This particular one, if the person has, it's very good for that. Okay, and some others too, carvedilol. Okay, so this class of drugs, they are also good for young people also. All right, so let's enter the class C. The class C, they're called calcium channel blockers. Calcium channel blockers. Calcium is required for the contraction of heart muscle. So it's blocking calcium, which will also do what? Reduce the force with which the heart contracts. That's how it operates. So this class of drugs, they usually end with pain, nifedipine, amlodipine, and they are better for elderly people. Okay, elderly people. But if you have heart problems, they are not good though. They're not good for those who have heart problems. Okay, and they're also better in blacks or African Americans. You understand? Calcium channel blockers. Now another one, the D, is diuretics. What do you mean by diuretics? Diuretics are drugs that help you urinate more, to lose more water. Okay, we have different types of diuretics, but these particular ones that are used for hypertension, they're called thiazide diuretics. Okay, so they help you lose more water, which will reduce blood volume and which will now reduce blood pressure. You understand it now? So these thiazide diuretics, they are also good for blacks, and also the elderly. So sometimes if you want to combine drugs together, at least add this thiazide. They are good for the elderly, older people, and generally blacks. They understand A, B, C, D. So that's the basic thing you need to know about. So before you start treatment of hypertension, you need to check the functionality of the heart. You need to also check the functionality of the kidneys. Okay, don't just go and start taking drugs anyhow. So you consult a specialist in heart and blood vessel problem, and that person is called a cardiologist. Consult them, they'll give you more professional insight into the kinds of drugs that you take to make you manage this hypertension better. What I've said is just to help you to participate intelligently. So when you meet someone that doesn't know what he's doing, you can easily spot it. When you meet someone that knows what he's doing, you also will spot it and participate intelligently to manage and treat your hypertension and bring it to where it is controllable. So share the videos to your friends and all those that need it. All right, I'm going to see you in the next video.